What we're talking about, when people say the hips, there's a certain misunderstanding of what is your hips. So actually what we've got is the ball and socket joint is where your femur or thigh bone joins into the socket of the pelvis. That's called your acetabulum. Officially that's called your coxofemoral joint. Many people consider that your hip socket or hip joint, but that can be confusing. Then along with that there's the pelvis, and the pelvis is two hemipelvises actually, which are three bones which join together when you were a kid. So one of them is called the pubic bone, another one's called the iliac, another one's is called the what's it called? Ischium. Thank you, right, ischium. So they all join together, but the remnants of those bones mark the hips. So if you touch down at the bottom of your waist, there is your pubic symphysis, where the two pubic bones have joined together, and that is the bottom of your waist. And I'll talk about that as being the bottom of the front of your core. Okay, the core is a tiny invisible spot, but if at least you can isolate that bit, that's good. So the bottom front of your core we can call the pubic bone, which is actually the pubic symphysis. Now when a woman gives birth, sometimes that opens up a little bit to give you more space to let the baby out. But that's a marker point. We'll call it the bottom front of your core. Just check you know where it is. And sometimes it helps if you're teaching other people to mark this point. You can't just say move your pubic bone. You have to find it first. People have to know where it is. Now that line there is also the same crease as your groins. So if you feel that level on your front of your thighs, lift up one thigh. The crease that happens there, euphemistically is called your groin. But actually that's where the hip flexes, which is bending forward like that. And inside that point there's the ball and socket joint. The ball and socket joint for the hip has got three main movements: flexion, extension, forward, backward, abduction, adduction, going out and in, and turning out. Okay, that's the ball and socket joint. They're the main movements of your hip, but then the pelvis itself can also move. And what you see is the pubic symphysis at the front. That's a joint. It can open and close a little bit, and it will in menstruating and in pregnant people. Then also on your here, we call these the sitting bones. So just feel your sitting bones where you sit on. They are your ischial tuberosities, which is the remnant of the ischium bone. And the ischium bone is basically down here, and you feel it from the ischial tuberosities, which is where your hamstrings attach. So there's like three sets of hamstrings, but they all join at the top here. And so that point you can think of as the beginning of your hamstrings, which is why sometimes I say when we bend forward, if you want to make sure your hamstrings don't overstretch, you push your sitting bones towards your foot. So find that little point which we sit on, bring right leg forward, left leg back, and push your sitting bone towards your foot. And when you bend forward, that will protect your hamstrings from overstretching. But if you lift your sitting bone away from the foot and bend forward, that will more likely tear your hamstring. Okay? So your sitting bones, your ischial tuberosities, are the back bottom of your pelvis or your hips, if you want to think of them that way. Then the top of your hips, here, feel this. This is called your iliac crest. So it's the top of the iliac bone. But the iliac, ischium, and pubis were all joined together, and the actual junction of the three is the ball and socket joint. Okay, now, the two of them start here and go around to about there, and they join at the back with your sacrum. So if one hand represents one hip, other hand represents the other hip, between them is your sacrum. And your sacrum joins onto the pelvis via the sacroiliac joint. So iliac here, and the sacrum joining between the ilium is called the sacroiliac joint. That's a source of pain in many people. And so what you can sometimes do is relieve a lot of sacroiliac joint pain by turning your thighs inwards. So what I want you to feel is, if you turn your feet outwards like this and push the hips forward, that often compresses the sacroiliac joint. But if you bend the knees and turn the thighs inwards and round the back out, that widens and lengthens your sacroiliac joint. Can you feel it? Now, but for some people, that will cause irritation, because I'm not using my muscles to turn my thigh in or out. I'm just using a posture. Sometimes you get a better result if you turn your thigh in and out using muscles. So that will feel one thing, And it may be good for you, may not be good for you. But if you use muscles to turn your thigh in and out, you can get a better result. Because if you do a muscle to do one job, then that muscle switching on will cause the muscles that do the opposite job to switch off, as I've discussed. So if there is pain in the sacroiliac joint, that may be because the muscles that turn your thigh out are too tight. And simply turning your thigh in can give some people relief. But for some people, if you turn your thighs in and do that, that muscle is tight, but it's just being stretched. The same way when a hammer comes on a knee and you hit it, it doesn't make, the hammer gives a slight stretch to the front of the knee. That stretch actually makes more tension. That's why the knee jerks. So by turning your thigh in and stretching the sacroiliac joint, that may make it for some people more painful. But if you use physical muscles to release the sacroiliac joint, then you send a message to the sacroiliac joint muscles to release. So now feel your buttocks, stand on the right leg, come to left toe tip, and then without moving your left hip, so put your left hand left hip, don't let that bit move forward or backward. That's the pelvis. Turn your thigh inwards. See, I'm not letting my pelvis move. Turn your thigh inwards. And then feel the buttocks should be soft. Now hold the hip again, turn your thigh outwards, the buttocks will harden. So when your thigh turns inwards, that will release sacroiliac joint, and that usually does a better job of releasing those muscles than simply turning the feet in, like this. Okay, so do the other leg. Put your right hand on the right hemipelvis. Don't let your pelvis move back and forth. Round your back out slightly and turn your right thigh in. And then feel how the buttocks will soften. If you lift the leg a bit off the floor, you might feel it more, but look at the floor for balance. Then, without moving the hemipelvis, turn your right thigh out. You'll feel the buttocks harden. And the buttocks hardening is synonymous with the sacroiliac joint compressing, which for many people will cause more sacroiliac joint pain. So turn the thigh in, buttocks should soften, sacroiliac joint opens, hamstring hardens, and the hamstring can be helpful for your knee. Turn your thigh out, sacroiliac joint compresses, which may hurt some people's back, but it also pushes stale blood away from that region, which can be a good thing, and the buttocks engages, which can help your hip. So it's not that one is right, one is wrong, both are useful. And that's why some of the exercises I've give you have involved turning your thigh in and out, because that pumps blood to the area. You just don't want to do anything that causes pain. So the sacroiliac joint is a major source of what we might call hip pain, but it could also be called lower back pain. Then another source of lower back pain can be your lumbosacral joint. So if you find the top of the hips, which I'll call the back top of the core, and you find the spine between the top of the hips, that junction there is called, usually it's the L4, L5 junction, which is officially the back of Manipura chakra. But if you go down 2 centimeters approximately, that's the L5S1 junction. So L is referring to lumbar vertebrae. There are generally 5 lumbar vertebrae, but in me, I've got 6 on the right side, 7 on the left side. I'm a bit strange. Okay, some people can have differences. So I'm giving you approximate for normal people, but everyone's a bit special. I know I am. And then from that position, the L5S1 is where most people compress their back. So if you lift your tailbone up, pull the shoulders down, for many people, like 9 out of 10, it will cause discomfort, compression. But the problem is that bit that bends backwards is below the level of the top of the hips. Now that causes a problem, because when you're bending forward to release that part, you have to bend forward from below the level of the top of the hips without bending the hips forward. So normally when people bend forward, they do 2 things. They either fold forward from the hips, so just feel the top of your hips with one hand, feel your sitting bones with the other hand. If you bring the top of the hips forward and sitting bones back, that's bending forward from the hips. Now can you see how that squashed the back a little bit? Now come back up. Now you can also bend forward from the spine. And so to bend forward from the spine, undo the hips, so you push the pubic bone forward or sitting bones forward, top of hips back. Don't let that move. Now bend forward from the spine, not the hips. Now that bending, keep the chin up, that bending happened less from L5S1. For most people, it happens from L1, 2, 3, 4. Okay? What we want is for that bend to go further down at L5, S1. But you see, you bent forward from the hips. So look at me for a moment. If I'm bending forward from the spine, not the hips, there's the top of my hips, I can only bend that far. Once I bend from the hips, that happens. Now, one of the things that's important to work with, if you can, is bend from the spine first. Bend from the hips second on most occasions.